But of course, that could change.
Right.
Of course it could. And so we are joined now by Dr. David Banach from UConn Health to talk about the spread of this infectious disease. And doctor, first, what should the state be doing to be prepared? And is there something the state can do to actually prevent an outbreak here?
So I think preparedness is an ongoing process. The state maintains a constant level of preparedness for any sort of emergency, including infectious disease-related emergencies. So I know the governor has been very proactive in reaching out to all the state agencies, including healthcare facilities, to ensure that healthcare facilities are prepared to potentially take care of patients who may come in with infection, and also ensuring that all the other aspects of government and the state are prepared as well.
You know, we saw about what state departments are doing. What can we do as individuals to make sure that we stay safe, that our families stay safe and healthy?
So it really comes down to sort of the fundamentals of infection prevention. So things like hand washing. We know that the virus can be spread through touching contaminated surfaces and then touching your face. So hand washing, using either an alcohol-based hand sanitizer or soap and water, frequently is a preferred measure. Additionally, avoiding close contact with anyone who appears to be sick. And then, of course, if you do become sick, really alerting a healthcare provider and trying to stay away from others is really the key message to avoid spreading any infection to anyone else.
This phrase, not if but when, is being bandied about today. Is that your assessment as well? Can we pretty well plan on coronavirus reaching Connecticut?
Yeah, I mean, I think there's certainly a level of concern for that. You know, we're seeing sustained transmission throughout the world, different areas, different countries. You know, we haven't seen that yet here in the United States, but the overall expectation is we'll likely see transmission within the United States. How sustained that will be, I think, it's a little too early to tell. But I always say, you know, preparation is really key. So certainly, you know, be concerned and prepared. No need to panic necessarily, but you know, being prepared is definitely the way to go for this.
And in your opinion, how prepared is the state and the nation to deal with a potential outbreak?
So I think we are prepared. Our state undergoes constant reevaluation of emergency preparedness, which is really critical. We've seen emergencies related to infectious diseases come up in recent decades, and each time, you know, we're prepared for them, and we build off of our experiences with those different infections in order to ensure that we maintain that constant level of preparedness. So I really do feel like our state is prepared. We have good infrastructure in place. And you know, a Department of Public Health that's very proactive, which I think is so critical in facing these kinds of situations.
All right, Dr. David Banach from UConn Health, we appreciate your expertise here today. Thank you.
Thanks for having me.
All right, President Trump is expected to speak about the nation's response to the coronavirus. That is at 6:30 this evening, and we will carry it live on air and on our Fox 61 News app.
Also tonight, friends and family will be holding a vigil to remember the two men who were shot and killed